One presentation is going to be on integrative family counseling. It was created by myself, Dr. Devlin, who is an adjunct faculty here, along with students Linda West and Nicole Andrews. I don't know where they are right now, so let's make this as interactive as possible so that it's not just me talking for the next 50 minutes. Feel free to just jump in at any time. Does anyone have experience with family counseling? None at all?
I do. One.
Who said that?
This is Erica.
Oh, okay. How much experience? I'd love to hear about that a little bit. Like, do you have a specific model you use?
I was working with a family support program. We were working with teens and adolescents coming home from wilderness-style programs. And right now I'm working in a family counseling center, providing individual and family counseling for mostly adolescents with ADHD, depression, behavioral issues in the schools, anxiety, that kind of thing.
Anyone else with experience with family models or family counseling?
I've done family therapy in the foster care system with juvenile delinquents, where I did individual family therapy and then also family group. Right now I'm doing family therapy with Hmong patients, which is really nice. A little cultural spin on it.
With what kind of patients, Alexa?
Hmong.
What is that?
They're refugees from Thailand. They were put in camps and tortured and all this other stuff. We have a very big Hmong and Somali community in Alaska.
Oh, wow. The reason that Dr. Devlin and I kind of gravitated towards this integrative family theory is because we noticed a lack of teaching integration when teaching the family models. That we're taught, about integration and integrating these different orientations in individual therapy, but with family therapy, there's not a whole lot of education surrounding that. And I don't know if anyone else has noticed that. But that's, really what we're going to talk about today. So the presentation's going to talk about the background of integrative family models, the current models that exist, and whatever implications we can find from them. Okay, so integrative models are used in family marriage and individual counseling, and it's been showing promising therapeutic results. The basic concept is that it's a purposeful combination, purposeful being the key word, of principles, practices, and common factors from different theories. It's been in use for the past 50 years, and it's shown to be effective for a variety of clinical issues. What does common factors mean? Does anyone know? Put you guys on the spot since it's just me. I know Alexa knows.
I know, but I'm not trying to talk the whole time. I said, I like how you put me on blast. I was like, oh, okay. Fine. And what was the question? What are the common what?
What are common factors? Just what does it mean?
Oh, I guess similarities that the families are struggling with. So let's say, like, I know somebody else was talking about they are working in substance abuse. So I think a similarity could be grieving for who their child was before they started abusing a substance, or it could be just coping with having a family member with the disease of addiction. So just a common ground.
Okay. Thank you. I'll stop bugging you. And yeah, and in this context in particular, we're going to be talking about the common factors in different individual theories related to family counseling and what are those factors and how can we use them regardless of one specific theoretical orientation. If there's anything in the chat box, by the way, I can't see it. Okay, so the background of integrative models. Currently, integrative practice has obtained widespread popularity. There is a growing body of research demonstrating the value of the approach. Smith and Southern believe that these models will eventually consume all unilateral theoretically approaches. However, we as counselors in training, we need to be taught how to ethically and effectively utilize integration in practice. Are we taught that enough as students or as professionals? Perhaps not. So there's a lot of models that exist currently that are referred to as integrative models. Integrative problem-centered meta-frameworks therapy, couple and family therapy integration, integrative couple therapy, multimodal therapy, integrative contextual therapy, technical eclecticism, biopsychosocial therapy, and just integrative family therapy. So an integrative concept encourages the development of reliable interventions that are effective. These methods are designed to match the strengths of the individual therapist and the individual client. What does the client specifically need, and what does the individual therapist bring to the table as well? Therapists are required to integrate evidence-based research and multicultural competence, as always, into the counseling practice. These integrative models present a comprehensive, integrative, multi-systemic, and empirically informed psychotherapeutic perspective. Okay, so psychotherapy integration can consist of these 5 primary methods. First is common factors. So these are the main components to effective psychotherapy that attribute to orientation. What do you guys think are some common factors across any theoretical orientation that would be useful when working with families, regardless of if you're CBT or whatever your approach might be?
Empathy.
Empathy. Absolutely.
An authentic therapeutic alliance.
Yeah. Which is different when you're working with families and couples than when you're working one-on-one with the client.
Mm-hmm. I mean, the ability to build rapport, make the client feel comfortable, provide a safe space, safe environment for them to be vulnerable and open up.
I think confidentiality also is something that is common, even if it's a struggle or not. But
yeah, absolutely, and I'm sure you know, working with kids, working with families, couples, confidentiality looks a lot different when it's not just one adult that you're working with. Technical eclecticism, improving the counselor's ability to select the best treatment for a specific population and problem. Theoretical integration is combining several theories and techniques. Assimilative integration is theoretical training in a single orientation with value-added techniques derived from other orientations. And unification are meta-theoretical approaches that place theories, techniques, and principles into holistic structures. Okay, so Jay Lebo, he had developed a model in 1997 that integrates the various theories, strategies, and interventions to create the most effective treatment for his clients. He's a really good person to know if you're interested in family therapy. He's been working in the field for a long time. He works with the Family Journal, and he said that since each family differs, we should approach families on an individualized basis, depending on what's occurring in that system. The family unit operates together, and it consists of multiple parts, which can help or hinder the overall function of the family. This model builds on a biopsychosocial perspective, I can talk, to further establish a foundation which helps the therapist and client Identify and clarify some of these potential contributing factors. So implications of this. So when you're learning integration, therapists need to turn to the common factors approach. They need to understand these elements that combine to form effective treatment. They have to be aware of the strengths and limitations of integrative therapy and how and when to use it. What do you think, and I'll talk about it, but I'd love to get feedback from you guys. What do you think the benefits or disadvantages might be of combining common factors, of using an integrative approach with families as opposed to just sticking with one specific theoretical orientation?
Well, I think that, you're serving two different people, which is usually two different personalities, or, two different learning styles, or whatever the dynamics are. So sometimes implementing different styles or techniques will cater and help another be able to invest more in treatment, be heard.
Yeah. Anyone else? I would say one thing, if you're learning to combine all these different approaches, that might mean that you think at least that you need to be an expert on every single approach. And that can be intimidating for counselors, especially for new counselors, if they think they need to know and use everything. Another limitation is that it can be harder to teach that. But a strength is that you are getting the best elements of every different theoretical approach and picking them and choosing them depending on what's best for each client on each client's system. So educators must focus on teaching trainees how to thoughtfully and sensibly integrate models, making the next generation of marriage and family therapists more prepared to practice in an ethical and effective manner. I can say from my experience, I don't think that my education has addressed too much family counseling. We got one class on it, and in that one, they didn't really talk about integrating models. There were certain different elements. What would you guys say? I know not everyone is in this program of your education as a counselor in training regarding family therapy. Anyone other than Alexa?
I was trained as a rehabilitation counselor numerous years ago, and so at that time, a family course wasn't required. And so even now, in the last alumni session, and we were talking about different things you have to do for licensure. So like, I know if I ever move to Virginia, I'm in North Carolina currently, so I'm okay here, but if I ever move back home, I will have to take more courses because I am not eligible for licensure because of the course. So because I don't have the family course for one. So I basically don't have very much knowledge about this, with the exception of the family practicum course that I helped to, like I was a TA for when I was a doc student.
So even in your doctoral program, you didn't get a lot of education on this?
No, so in the doc program, you kind of choose, well, in my program, we got to choose our focus, and mine was college student development. So I took my elective courses in college student development. So with the exception of being a TA for the family class that the master students were taking. No, we didn't talk much about families, but again, a lot of that too is because we focus more on, teaching, supervision, advanced theories, things like that.
Yeah. Thank you. Anyone else with thoughts on how their education prepared or didn't prepare them for a marriage and family therapy?
Well, for now, California, our courses are not really focusing on the marriage and family aspect of it because I'm currently in a master's level and my classes had not really focused on it. It was mainly counseling 1 and counseling 2, but it's not very direct at couple of it's just counseling in general. The requirements are actually ethics and others, and it's not really family. So maybe when I start my doctoral program, I will be exposed to that, but at this time it was very brief, maybe one topic in the whole semester.
Yeah. And I mean, all of our clients are part of a family, right? Whether it's chosen or not, they're part of some system, and we need to, I feel, be able to, approach our clients as part of some kind of family system, and at least have these skills. So, I think that our education right now needs to help prepare us a little bit better, help us learn maybe not just some specific family theories that we'll forget after that class, but how can we integrate things from everything we have learned, all these different orientations, using these common factors to best serve our clients and their family systems. Was there something in the chat box? Just seeing us stuff.
Yes, people are responding to your questions in the chat box. So I was just wondering if you wanted me to interrupt you and keep them off, or how you want to do that.
You can interrupt me.
Okay. Tanisha said that it was briefly, they discussed it in a previous program, but no class. I think Ginger said in her master's program, she took a marriage and family class as an elective class, but it wasn't a requirement.
As an elective too, it wasn't even required. Any thoughts on why that is? Why they don't require it? I don't even know the answer to that question. I think it should be required. At least one required class.
This is Ginger. My coursework was in school counseling, so marriage and family wasn't required for that program, but I felt like that was a line of study that I was interested in finding out about, and I felt like in helping the children, obviously if the family was having a crisis, it would impact the children, so that was something I needed information about, even if it was just an overview. Marriage and family is something I've always been interested in as a possibility in the future, so I took the class, and it is something I'm interested in as a possibility in the future, but it was not required, and that's been some years ago, my master's program, so it may be different now.
It's not terribly different in our master's program right now. Any other? Okay. Latricia said it's required in her doctoral program, but not in her master's. And what kind of doctoral program is that? Well, any other thoughts on that?
Well, in my program, mine was clinical mental health counseling, and there was an entire separate, MFT program. So I don't know if maybe, if people really want to dive really deep into MFT, they just get into that program, and those who are just in a more general clinical mental health, maybe there's an assumption that marriage and family really isn't of interest, or I don't know. We only had one family counseling class that was a requirement, and then there were electives, like a couples counseling class that I took. And I think there was a child or play therapy class or something that was also an elective. So I guess maybe it's just a matter of what program you're in.
I don't know, even if you're working at an agency that sees clients predominantly individually or for group therapy, a lot of agencies have options for couples or family counseling, and the counselor might not be prepared for that. I worked in addictions, and a lot of times, young adult clients we would want to have sessions with family members, and clinicians might not be prepared for that if they got one class in their undergraduate education, or none at all if it was an elective that they didn't take, and it's a completely different dynamic. Send me the references for that. Okay, so this is going to be a shortened session. Yeah, I apologize for the lack of co-presenters, but we can keep this one short. I'd love to just talk for a few minutes and get additional thoughts. You will get full credit for being here for the full hour. Tina, you said what are the KCREP requirements for what? Oh, what does KCREP require that we get in family counseling? I don't believe that KCREP specifies. Does anyone know the answer to that?
Looking that up while you all were talking.
Yeah.
And I'm on my phone, so it's difficult. So essentially, I'm looking at the information under the most recent 2016 standards. And under the 8 common core areas, family is not included under that. So those 8 core areas are professional counseling, orientation and ethical practice, social and cultural diversity, human growth and development, career development, counseling and helping relationships, group counseling and group work, assessment and testing, and research and program evaluation. So I assume that programs aren't necessarily requiring the family course because it's not necessarily required as a core under those standards, unless someone else knows something a little bit different. But that's just what I'm reading from the website right now.
No, I think that's exactly right. And I think it's interesting that we were saying like, oh, well, maybe people don't want to go specifically into family counseling. Well, career counseling is on that list of KCREP requirements, and a lot of clinical mental health counselors don't go specifically into the field of career counseling.
But I think there's some value in that because many of the clients are going to have careers. And so I guess, and same with families, which is why, certain states require it. So, I mean, I don't know why they haven't added it, but, I don't know why they haven't added it. This is the only thing I could suspect. When you're when you're doing clinical mental health counseling, you may only be engaged in individual counseling. And that will definitely come up with career counseling. But if you are going like the marriage and family route, a lot of times that course might be designed to help people actually work within the system. So like me personally, I don't see families or couples very intentionally. So the family class would be helpful to understand the theories, but I wouldn't necessarily be engaged in the activity of being a family counselor. So maybe that's the reason. That's the only thing that I can come up with off the top of my head.
Anything else? All right. Thank you guys for being here for this shortened session. Get a half-hour break. Come back to the next one, and for being here.
Thank you. Is there a link for the evaluation? Oh, there it is.
There it is.
All right. Well,
All
thank
right.
you, Jennifer.
Thank you guys.
Bye-bye.
Bye.
Thanks, Jennifer.
Thanks, Maya. You are following me.
I know. Please tell me I have my whole list. Tell